Monday, July 27th. In accordance with the governor's order suspending certain provisions of the open meeting law, general law, chapter 30A, subsection 20, relating to the 2020 coronavirus outbreak, the July 27, 2020 public meeting of the Norfolk School Committee shall be physically closed to the public to avoid group congregation. Alternate public access to this meeting shall be done via Google Meet, online video conferencing. This application will allow users to view the meeting and provide comments during allocated windows as outlined in the board's public comment policy. To join, follow the web link or call the dial-in number listed below under the start/call to order. The meeting will be recorded for future rebroadcast by Norfolk Community Television. And as we start out every meeting, we'll read our mission statement, which is the Norfolk Public Schools offers a safe, joyful, and challenging learning environment that meets the needs of our diverse students. Through school, family, and community partnerships, we provide an education that inspires lifelong learners and cultivates caring and productive citizens of our ever-changing world. Roll call, please.
Jennifer Wynn.
Medora Champagne.
Shannon Meneses.
Sarah Ward.
Thomas Doyle.
Oh,
I think I talked over Ingrid, but Ingrid and I are both here.
There we go.
All right. So I see we've got a number of folks on here, which welcome. Thank you. We don't usually typically get that, so that's nice. So now is the portion of the evening for any sort of public comment folks wish to make. I don't know if anyone wishes to do so or if they want to just listen to see what we discussed this evening. You're more than welcome to. The only thing I've asked, if you do speak, just please identify yourself, name, address, just keep it about 3 minutes. We may or may not directly respond to something, just so you know. That's not us being rude, that's just our policy. And then hopefully we can address a question that, if it is raised, we can address that later during our actual meeting itself. So I'll throw that open for a second. If anyone wants to jump in, feel free. All right. Looks like everybody's in listening mode right now, which is probably a good plan. So no correspondence, nothing from me this evening officially. So we'll skip right to Ingrid to get to the discussion of the hour here.
All right. So we have four major things to talk about tonight. The first, I was going to start with giving the school committee an update of where we are as far as our school reopening plans. We were going to talk about a scheduled change to the school calendar. I'm going to recommend that we suspend that, and I'll give you the context of why. Talk about the fixed rates for non-union members for their COLA, and then the possibility of offering an early retirement incentive. So I'm going to jump right in and start with the reopening update. First of all, I just want to thank our administrative team, all of our teachers that are serving on the reopening committee, the parents that have joined us. Our administrators have been working around the clock. Most haven't seen a vacation day since long before COVID started. So they put in a lot of time. The NTA has been great and has been available throughout the summer to consult and collaborate on issues. As I said, we have a lot of teachers serving on the committee and parents. So thank you. It's been, as those of you who have been part of it, it's a Herculean task to develop 3 comprehensive plans, but we're really in good shape due to the time and effort that people have put in. So I want to recognize that up front. We also have Medora serving for the school committee on the reopening committee. So I don't think I mentioned school committee, but we have their input and support as well. So thank you, Medora.
I'm not doing the heavy lifting. You guys are doing the heavy lifting.
So where we are to date, the Massachusetts Department of Elementary and Secondary Education has required all districts to develop 3 comprehensive reopening plans to fit different scenarios. The first would be a plan for a full in-person return to school. The second is for a hybrid model, which would basically have students spending part of their week in school or part of their time in school learning in person and part learning remotely, and then a full remote learning plan. The school committee is responsible for voting on which final plan to implement, and we are asked by the Department of Education not to do that until the beginning of August, because we want to be able to consider the most recent up-to-date data on COVID cases in the state and in the local area, as well as what's ever changing in terms of the medical research, so we can make the best decision possible. So the school committee will be voting on that in the final plan in early August. So I want to update you on where we are with the 3 plans that we are currently developing. First, I would like to address some of the safety and health procedures and protocols that we've been working on putting in place, because those are relevant to either of the in-person learning scenarios. Based on the guidance from the Mass Department of Education, as well as the guidance from the CDC, we have moved forward with ordering personal protective gear for all students and staff. We have, for all staff and students, we have face masks available. We have NP5 masks as well as surgical masks. Students and staff are allowed to bring their own masks when they return in the fall, but we have available masks for anybody who needs them. In addition to, for PPE gear, for students and staff, or for staff that may be working with students that are unable to wear a mask, and for our nursing staff, we have additional PPE gear. We have disposable gowns, we have face shields, we have eye protection, we have shoe covering, and we have nitrile gloves. We have offered and will make the additional PPE gear available to any staff member who requests it as a result of their role or individual health concerns. And we do have currently in stock at least a 3-month supply of all that gear to carry us through the fall. We have also gone ahead and ordered additional hand sanitizer and all of the cleaning products that we will need to increase the frequency of cleaning and sanitizing of educational spaces. We have hand sanitizer that will be available throughout the entire building and in every classroom and small office space. We have worked with our nursing team, and the nurses I should thank as well, who have dedicated a lot of time to contributing to this plan. We have protocols in place for increasing hand washing throughout the day, upon arrival, before and after lunch, and during throughout the day. We are also discussing and hopefully being able to fund through the state CARES grant money that was allocated to the town of Norfolk, temporary positions for an additional day custodian in each building. With students returning to school, we want to be able to increase the frequency of cleaning of common spaces, high touch surface areas, cafeteria spaces, anything like that. So through CARES grant funding, we're looking to add temporary additional custodial staff to each building. We are also working on, if you've been in recently, you'll see in the offices, we've added plexiglass dividers to keep the office staff protected from the public coming into the building. We have also put signs throughout the building. We'll be marking hallways. We're going to limit and restrict movement throughout the building per the guidelines of students. We are marking hallways and looking to try to have one-way traffic flow patterns through our hallways. We have signs marking appropriate social distancing spaces in office spaces, and we will be doing that as well in classroom spaces. We have moved forward with ordering and installing, as I said, the plexiglass dividers in the office, but we are also looking at, in each classroom, having a table with subsections of plexiglass dividers so a teacher could meet with 2 to 3 students at a time safely. And we are also looking at putting plexiglass dividers in all of our therapy spaces, so that staff meeting one-on-one with students would have that additional barrier protection. We have also prepared and established isolation spaces in each building adjacent to the nurse's office, where if a student or staff member presents with any symptoms, they would be placed while they can be treated until they can be picked up. We have put together protocols, and our nursing staff is working on that based on the most recent guidance from DESE of what the district would need to do to respond to a student or staff member testing positive with COVID. And those protocols will be available also in our final report. But we are required, if there's a positive case within the building anywhere, to close school for 2 to 3 days for deep cleaning. And then we would have to do contract tracing with our nurses as well as the public health nurse to determine anybody that has come in contact with somebody that was COVID positive. And those people would be required to self-quarantine for 14 days. The CDC just shifted that to 10 days, so we are waiting for updated guidance from the state on that. We have also set up model classrooms, so there is 2 different plans. The state has talked about having 3 feet of social distancing for students wearing masks in classroom. So we set up model classrooms with a 3-foot social distancing model. In those classrooms, we can fit about 20 student desks, but there is no other furniture in the classrooms. We've also looked at the 6 feet social distancing guidelines put out by CDC and some other government agencies, the National Science Foundation. And those that in that situation, we can accommodate about 12 student desks in most of our classrooms. We have spent a lot of time making sure that all of our HVAC systems are current. We do have a full-time HVAC employee at the town who also serves the schools. So we have a regular HVAC person on staff. All of our filters to all of our systems are regularly replaced on our preventive maintenance schedule. And they have also worked to adjust the settings to bring in more outdoor air and increase that outdoor air exchange. So the recommended guidelines is at least 10% of outdoor air coming in through your system, and we are set currently between 40 and 50%. So we've made those adjustments. We are also working, our nursing staff has done training for all of our summer school staff on the effective use of PPE gear and safety protocols. We are preparing that training for all staff for prior to school opening. We are also working on putting together directions for parents regarding clear expectations for district safety. So what the guidelines for mask wearing are going to be, what the mask breaks will look like, and clear expectations for parents as to when to keep a student home. We are working on protocols for daily staff screening. And we also have protocols in place for subs or any visitors to the building. We will not be allowing parents or outside visitors to access classrooms at least during the fall. We are also limiting students to cohorts, and we're limiting travel between cohorts so that students will stay with their class for the majority of the day. Special subjects teachers would travel to the classroom so that students won't be in and out of commonly used spaces. Any questions before I move on safety?
Not for me.
We do have 3 nurses on our reopening committee. The town of Norfolk also contracts with a visiting nurse from Walpole VNA, and that is the nurse that consults to the Norfolk Board of Health. So all of our protocols and procedures we run by her. 2 other things I should mention as far as safety. We are looking at H. olive day because H. olive day is not air conditioned. The public health nurse has looked at diagrams and designs for installing fans at the in the upper. There'll be wall-mounted ceiling fans that will help exchange air out to the outtake vents. So it won't be circulating air around the classroom, but will increase circulation of air in those rooms. We also will have a walkthrough of all of our educational spaces with the medical team at the end, just to make sure there's nothing that we missed or any additional considerations we could make. So I'll shift.
Ingrid,
Go ahead, Medora.
Nope, it's Jen.
Oh.
I have a question. Why, you said before you bought 3 months supply of PPE gear or cleaning gear. I'm just curious as to why only 3 months. Is there a supply issue?
We continue. We ordered ours very early in the summer because we wanted to make sure that we had enough gear, and there was some competition statewide to be able to get that material. So we did a bulk order and made sure we had at least 3 months supply in-house to start the year. We continue to add to that stockpile, but we wanted to make sure that we had more than sufficient supplies to open. So we went out early and we procured the majority of that, or actually very early, late June, early July. So we continue to add to it.
You'll continue. Yeah, I knew you would. And back when you said that you're looking into plexiglass for small group work, which I think is great. That means, it's implied they would not have to wear a mask in a small group like that if there were plexiglass?
If you're sitting on the other side, yes, on opposing sides, the plexiglass, that would replace
that small group is.
And would have to be students.
And when students are in isolation, obviously a staff member is an adult, but who's supervising them if they're in a room next door?
Our nursing staff would be overseeing that until they exit the building. And those isolation spaces we have we can shut off the air circulation so they don't circulate air from there through the HVAC system. So they have dampers that can be closed if we need to access those spaces.
Okay, and I'm assuming at some point we'll talk about lunch.
We will. We'll get to that as we sort of go through the
All right, that's it.
Yeah.
Thank you.
Yeah, we have a couple people have asked questions, so I think that's what Jen is mentioning here. So I think the specific question, and this is so unique, I think it makes sense for us to go ahead and do it this way. And I think you kind of answered this, Ingrid, but in the event a student is in isolation and say the nurse there has to return to her office for something, there is obviously somebody else who then comes and takes the individual's place. There's never a situation where students by themselves is what I'm getting at.
Right, students would be by themselves, and both of our isolation spaces have windows, so the door could be closed, and staff can still supervise anybody that's in there that needs it. Yep.
Okay, and then the other question came up regarding isolation is it has an exit, obviously. I presume at least 2.
Students would not walk through the building. The isolation rooms are near the nurse's office in the front office, so they can leave through the front door. They wouldn't be able to go back in through the building where students and staff are. So in both, the isolation room is next to the nurse's office, which is by the front entrance.
Okay. I'm not sure if that answers the individual's question that was asked, so I guess they can always clarify if they need some more information.
The building without going back through the hallways or through classrooms.
Okay.
From the isolation space.
Thank you.
Okay, so in planning for the full return to in-person, as I mentioned, in order for us to implement that full return to in-person learning, we have to follow the DESE guideline of 3 feet of social distancing between students in the classroom. We can only fit with the 6-foot requirement, 12 desks in each classroom. So for a full return, we would have to go with a 3 foot of distances between desks. That would allow us to accommodate approximately 20 students in each classroom. There are some classrooms in Freeman Kennedy. They're 6-sided classrooms. They're oddly shaped. In those classrooms, we can only accommodate about 17 students with the 3 feet of distancing. So for the full in return, in order to accommodate all of our currently enrolled students, we would have to add an additional 5th grade class and an additional 6th grade class to reduce the class sizes to accommodate students in those 6-sided classrooms. We just received the guidance from DESE last week for transportation. Transportation, we can have 1 student per seat. All students required to wear masks on the bus. Siblings would be able to be seated together, but that takes the capacity of a 73-seat bus down to about 23 students. With our initial survey, we know about 300 families are planning to drive students, but we would have two-thirds of our students that we would have to transport, and we can only accommodate 1/3 on the buses. So we would have to double our bus runs, which means we would have to stagger arrival and dismissal. We would have half of our students arriving at the typical time, about 8:45. We would then have to disinfect and clean all buses and send them out for a second run. And the second group of students would arrive at the building around 9:15. We would also have to do the reverse on the other end for dismissal. Half of our students would have to be dismissed around 2:30. Buses would have to come back, they'd have to be cleaned and sanitized, and then we would have to dismiss the other half of students. The other things that we're looking at with the full in-person return, so DESE is saying that districts can use the 3 feet of distancing in classrooms when students are wearing masks, but during lunch, snack, and mask breaks, we're required to implement 6 feet. As a result, to accommodate lunch in the full in-person return, we would have half of our students would have to eat in the classroom, and then we would have to use all of the other available open spaces to accommodate the overflow. So our cafeteria with the 6 feet guidance, all students have to face the same direction. We can only accommodate 38 students during a lunch period in the cafeteria spaces in both buildings. We have some grade levels that have over 150 students. So if you have half in the class, you would have some in the cafeteria, and then we would have to put 12 students in probably the band room or the chorus room or any other open classrooms to accommodate the lunch. We would have to stretch the lunch periods over a longer period of time because between each group in the common spaces, we have to clean and disinfect, and disinfecting products to work have to sit for a period of time before they can be wiped off in order to have kill or sanitize any viruses. So lunch would be spread over a longer period of time with gaps between each grade level and would take place in both classrooms, the cafeteria, and additional open spaces. What our challenge will be in the full in-person return is also that mask breaks and snack would be required. We would be required to implement that 6 foot of social distancing, so those would have to take place outside. We would not have a place in the building to accommodate those. The other model that we are looking at and planning for is the hybrid learning model. So in considering the hybrid model, we did send a survey out to parents and staff to see what people's preferences were for how that could be structured. The survey results, we have about 590 parent surveys back and about 90 staff surveys back at this time. They're due tomorrow. But the current trend indicates that about 80% of parents prefer the split week model versus alternating weeks, and 90% of staff members prefer the split week for instructional reasons. That is the structure that is being employed by most districts in the region. There are quite a few that have already voted to move forward with a hybrid model at all grade levels. In our model, students would spend 2 days a week in in-person learning. So we would have one cohort that would come to school Monday and Tuesday for full days. In the hybrid, because you're splitting staff, we would only need one bus run. So start and stop times would be consistent with what they are now. Half our students would come Monday and Tuesday. Wednesday would be a remote learning day for all students. They would have instruction from their classroom teacher on that day, but they would also have assignments that they'd be working on and additional remote activities. During the Wednesday gap, we would be doing a deep cleaning and sanitizing of the entire building and all educational spaces before the second cohort of students comes in for Thursday and Friday. Then obviously over the weekend on Saturday, we would thoroughly clean and disinfect the buildings again before. So we would be cleaning and sanitizing between each cohort of students that come into the building. We are considering, and we haven't made a decision, but we are considering possibly implementing a different hybrid split for kindergarten and for preschool based on the developmental needs of those students. We have some feedback from both the parent and student surveys, parent and staff surveys. There are some districts that are considering for just kindergarten and preschool going more with what we used to have was a half-day kindergarten where some of the students come in the morning, we clean and disinfect between, and then the others come in the afternoon. Students in that model would not have lunch or specials during the time they're in school. Those would be the remote part of their day. Whether or not that's feasible depends on availability. We'd have to add a midday bus run. And we have to really see for parents that have students, and we'll send a second survey out for parents that have students in kindergarten and in the other grades, whether that is more challenging or if that is a preferable model. So we're looking at that. The only reason we possibly consider that for kindergarten is the developmental levels of the students. It's very hard for young kids to sit at a desk for 6 hours, and there's less movement throughout the day and throughout the building. So it's possible that we may consider that for just the pre-K and K levels. Remote learning. We have been working on developing the remote learning plan. It will look significantly different than what we had when we implemented remote learning in the spring. Our team started by looking at infrastructure and equipment needs. The district does intend to shift and transition to a one-to-one student device model. We've been able to access the grant funding from the state to apply for funding to purchase additional Chromebooks and iPads for all of our kindergarten students so that we would have a device for every student. We would also be taking apart the shared Chromebook carts that we use in our computer labs and maker spaces because we will not have students sharing any equipment next year. With that, we will be able to assign an individual device to every child, and we're in the process of purchasing carrying cases so students can bring their devices back and forth to school. That would really be helpful in the case of an emergency, or if we're notified in the evening of a potential potential COVID case and we're required to close, students would have access to the tools they need for remote learning with them. None of that funding is coming out of the district budget. That all of the additional technology purchases have come from state grants. We're also looking based on feedback. So we had a lot of feedback from parents right at the end of the school year. We did a survey to get information about what worked and what didn't work for remote learning. Our team is also looking at quite a bit of research that is looking at which models are most effective and lead to the best learning outcomes for students. So we are looking at having a common platform for managing all of the district-wide remote learning, especially for grades 1 through 6, so that it's a little more seamless and easier for parents to navigate. We are also looking at the state is in the process of purchasing an outside resource learning management system. And we don't have a final decision from the state on what they're moving forward with, but we are going to be looking at that and determining whether or not that's beneficial and whether we want to integrate components of that into our remote learning platform. We will be increasing the amount of teaching and learning required. The state is not going to vary the time on learning requirements. So in the spring, kids were only expected to do a half day. They will be held to the full expectations for learning time. There will be more direct teaching and learning, whether that's pre-recorded lessons or live lessons may vary as it did by grade level and developmental needs of students. We'll be working with the NTA on finalizing that plan, but we will be incorporating the other content areas, so social studies and science, into our remote learning platform. Student work will be graded versus pass-fail, which it was last spring, and we'll make sure that students have plenty of opportunities to connect with their peers, and that we can address the social emotional needs of students as best we can in that model. So those are the 3 plans that we are in the process of completing. We will be submitting what we are required to submit to the Department of Education July 31st, which is this Friday, is just an outline of each of the 3 models. The school committee will then vote on the final plan. And again, the Department of Ed is suggesting that happen the first week of August. So I am hoping that we can schedule the next meeting at the end of our meeting tonight, but would recommend that we try to meet next week, possibly Thursday, August 6th, if that works for people. And at that point, I'll have a PowerPoint presentation to really go through the details of each plan. I'll have photos so that you can see what the classrooms and the spaces will look like. We could look at a different night, any night next week that works for the committee, but I will have all those materials so you can have a visual image of what the classrooms will look like, and we will be prepared at that time to make the final recommendation from the reopening committee. I did want to highlight tonight that implementing the full return to in-person learning is becoming less feasible based on some changes in the medical literature and the research. So the most critical problem that we have is that there's significant variation among the medical community with regard to the amount of physical distancing students need in order to create a safe learning environment. So as I said, the medical team that's consulting with the Department of Ed feels that 3 feet of social distancing with other protective measures, so masks, hand washing, other things in place, is reasonable. The Center for Disease Control was, we looked at all of the research, and they're looking at studies both locally and internationally. They updated their guidance for reopening just this past week. Again, everybody is strongly supporting getting students back in school. We know that their academic and social emotional needs are best met in that model, but CDC is holding with the recommendation for 6 feet of social distancing. As I mentioned earlier, if the committee decides to adopt the 6-foot guidelines, and we're going to continue to monitor the research over the next week and see what happens in the state as far as COVID. But if we go with the 6 feet of social distancing, it's not possible for us to bring all kids back. We would have to actually double our teaching force. So if I have 160 students, which we do in kindergarten, I would have to add 5 or 6 teachers in order to accommodate just having 12 students in each classroom. Not only do we not have the physical space, even with repurposing all available spaces like library, gymnasium, band, music room, we could only accommodate a handful more classrooms. We can't add 4 to 5 at every grade level. So we don't have the physical space, but we also don't have the staffing or the finances to support that. So what happens over the next week and a half as far as the social distancing will really impact significantly what our options are for reopening. Again, the Mass Association for School Superintendents has also been collaborating with 2 independent groups, the Ariadne Labs and the Learning Accelerator. They are a medical team as well as a team of educational consultants who have been asked to really comb and review all the medical and educational research that's out there in terms of impact of school closures, safe returns internationally. In Israel and in a lot of other countries, they've started with returns, so there's some data on that. And they have been charged with trying to put together recommendations and implementation guidelines to help districts make decisions. That report is now available to the public. It's called the Parabola Project. I'm happy to share the link out with anybody who's interested in it. But that team is, the team that was involved in that project continues to maintain recommendations for 6 feet of social distancing in the building and in the classroom. So our plan at this point is to continue to monitor the research, to finalize all the structural details of all of our reopening plans. We also have curriculum teams that are going to take the ball from here and start working on the adjustments that we need to make to the curriculum for all 3 different models. And we would move forward with recommendations to the school committee at the first week of August, which will be next week, for a vote on a final plan. So that's where we are, and I'm happy to take any questions that people may have.
Well, you know I have questions. First off, I just want to say thank you to Dr. Alardi and the reopening committee, the teachers, the parents, the extra staff that I'm forgetting. I know how many hours, I work in Franklin, I know how many hours and how agonizing it's been for the administrators, teachers, everybody, parents. So I really want to thank you for all that time. There's no easy answer, and not everyone's going to be 100% happy with whatever happens, kids included. And just because you were cutting out a little bit, Dr. Alardi, I just want to confirm that in order to go back everybody full time, and to have it 6 feet apart, we would need to add 5 or 6 teachers to do that, correct?
No, it'd be 5 or 6 teachers per grade level. We would have to double our teaching staff.
Oh, okay,
can
all
only
right. And
fit our
clearly
class sizes
there's no money for
20.
that.
Yeah.
I just want to confirm, but if they are 6 feet apart, they do not need to wear a mask in class?
That's what they would need to wear masks, but they could take mask breaks in class seated at their desk, and they could eat lunch and snack at their desk. Recommendations now are that students could take their masks off for a period of time, but not for the full time they're seated at their desk. But they would be able to take a mask break in the classroom, a short snack break in the classroom, and they'd be able to eat lunch, where they cannot do that with the 3 feet guidance.
And they cannot do that with the 3 feet. Okay.
Right.
And at least with 6 feet, you'd have 12 desks, and that's a smaller classroom. So that's always good when you have smaller classrooms, in my opinion, for learning. My next question is, have you considered bus monitors? Just because I had my meeting in Franklin today, and I thought this was a good idea. They're hiring bus monitors, and then they're going to possibly use those bus monitors for lunch monitors, because you're going to have who's going to be it's so hard to get staff as it is, and subs. Who's going to be monitoring all these lunch periods?
They're eating in the classroom.
We haven't made a decision on that. That's in terms of the bus monitors, we haven't made a decision on that. We just got those guidelines, and we're looking at 23 students. We are going to send a survey out again to parents now that we have the final guidance, and find out who plans to ride the bus. With 21 to 23 students on a bus, the monitors that other districts are looking at are really just to enforce the mask guidelines. So that is something districts are considering. We would have to prioritize that in the context of all the other costs that we're looking at to determine if that's essential or not. The other thing with the buses is, especially for the fall, they will be keeping the windows open. So you will have fresh air circulating through the bus, which also limits spread.
Yeah.
You can really keep the windows cracked even if it's raining out. So there's other protective factors that we can put in place for that.
And my last question is, I know you said that you were looking at for at least first grade on 1st through 6th using one platform. Is Google Classroom, is that used by KP? The reason why I ask is I thought maybe I think that's what KP uses. And then I thought siblings could help the younger kids or help the parents or.
Yeah, I would have to KP. I know they use Google Classroom in some areas. I don't know if they use it universally, but Google Classroom is what we have been using. We use something different for 1st and 2nd last year, but we're talking about the potential of Google Classroom across the grades. And kindergarten uses something a little bit different called Seesaw that is better fit developmentally.
Yep.
So
I agree.
May have one platform for kindergarten and then something that aligns for all the other grades. But the teaching staff and our curriculum director are working on that with the remote learning plans.
Okay. Thank you.
Okay. Sure. Anyone else? I'm sorry, I'm seeing some questions in the chat, and Thomas, I don't know how you want to handle it.
Yeah, hold on. Let's see. Question came up. Would those parents who want to opt in for the full-time remote option be able to do so independently of what the district decides?
Yes. So in the last communication that I sent out to parents, we will, because of the level of interest that we saw on the initial survey, we are going to provide a remote learning option for any parents who choose that. We will be, once the final plans are published, we will be making available to the public on August 10th, a comprehensive published report with an executive summary that outlines the details of all 3 plans. After parents have had a chance to review that and know which direction the district's going, we will ask people to confirm whether they're returning or whether they would be opting into a remote learning platform. It will be, we haven't seen what the state is adopting yet. We may adopt what the state chooses and supplement with local resources, but we will have teachers will track attendance, students will receive grades on the remote learning platform, and we will develop ways to keep them connected with their classmates as well as with staff at the school. So that will be an option.
Very good.
Okay. There's one other question and one other thing that I should mention. So in the hybrid approach, what do the remote options look like? We're still working through that. They will be probably a combination of synchronous and asynchronous learning, but we are working through that because we just received, the Department of Ed just released the remote learning guidance Friday night at 5 o'clock. So our team hasn't even had a chance to take a look through them, but there will be some balance of live instruction and some probably pre-recorded asynchronous learning.
Then there's a question regarding the research groups that we're using to gather the data and suggestions.
Yep, I'm happy to provide that link. The Parabola report was released to the public Friday, so it's available. If you Google it, you'll come up with it. It's the reopening guide based on the Parabola project. So I can try to send you the link individually, but if you Google it, you'll find it, and you can probably find the link through the Mass Department of Ed website as well. So happy to provide that. Any other questions?
Lardy, it's Jen again. Did you mention too that the superintendent council, forgive me if that's not the right name, but that they came up with an independent study as well? MASC?
Yeah, that's the Parabola project. So MASS
that's the
contract.
Same. It's the same. Okay.
The two outside agencies.
Okay,
yes. Yeah.
You. Okay.
So I was happy to send that and share that. The other thing that I did want to mention is that we do recognize that a hybrid learning model is really challenging for parents, for working parents. And we are in our reopening committee looking to try to do some outreach without some other organizations, such as the YMCA, the Adirondack Club, the Norfolk Rec Department, to try to see if there are any outside agencies that may partner to think about hosting a supervised remote learning center. For parents that need that. I can't promise that, but we are actively looking into whether there are agencies that would contribute and provide that kind of option for families that need it. So our parents on the Parent Reopening Committee, we're going to be talking about this tomorrow. I know the YMCA as an organization has reached out to schools and offered space to schools that were short of space. And in the past, they've worked really well in terms of trying to coordinate programming. So we are in the process of looking at that. And, you know, if we are able to coordinate with another agency, parents may have an option independently of the schools for support with that. Okay. Any other questions?
Another question just popped up. I guess there's a question regarding those who choose remote learning. Will that change the number of students physically in the school drastically?
It's a great question. On our initial survey, we had over 930 responses. We only had 37 families choosing remote. So we do not expect it, and that was spread over all of the grade levels. So we would have 5 or 6 students per grade level. We felt that it was enough of a mass that we wanted to provide something through the district to supplement the state. And we also feel that over the course of the year, families may change their mind if the situation and whatever model we implement could change. So if we start in a hybrid learning model and case numbers go way down and there's additional new research that comes out, the school committee may vote to make a change to the model we're implementing. It really has to, our top priority is keeping children and keeping staff safe, supporting social emotional needs of all members of the community, and providing strong, rigorous instruction. So those are our priorities. And as the situation evolves, we are going to monitor it, and we may make shifts based on the best data that we have available to us.
And the question popped up whether or not the school would start on time for the year.
So that's a good question. One of the next items that we have, and I don't know, do you want me to jump to that? Because I'm going to talk about that with the calendar item.
Yeah, that would seem to make sense. It's a good jumping point to that.
Okay. All right. So as far as the learning plans, we will schedule the next school committee meeting, and at that time, I think we will move forward with a vote for which plan we will implement in the fall. The school calendar. So we know that based on the significant changes we have to operations. So we have shifted our arrival and dismissal procedures to limit the number of students coming into the building. We have to change our lunch guidance. Staff have to get used to wearing personal protective gear and have to know how to use it safely. We need to do some training on signs and symptoms of COVID and what the protocols are if you have a child that's sick in the classroom. So in addition, we have to do some significant revamping to all of our curriculum. We have to be able to assess any learning losses that students may have experienced as a result of the school closure, determine what their needs are, and we have to adjust our curriculum accordingly. As a result, I was going to propose tonight to the school committee that we take the professional development days that are scheduled for later in the year and move them forward to the beginning of the school calendar. About an hour ago, we received a notice from the Commissioner of Education that they have shortened the student school year by 10 days. And they are asking districts to put those 10 days at the beginning of your calendar and use them to make sure that we provide sufficient time for planning, for curriculum and instruction, and for training of all staff. The Department of Ed is going to require schools to start by September 16th. Given that, I am going to suggest that we withdraw the calendar proposal that we had brought forward for a vote tonight, and we work with the association to figure out how to schedule those days and come back with a revised calendar for the committee to vote on at our next school meeting. Questions on that?
Yeah, I would agree. I would think that makes sense. I don't think there's any point of voting on a calendar then that's going to possibly immediately be changed to the next meeting. So I'd rather just postpone it if everybody's okay with that.
Mm-hmm.
I'm okay with
Yeah.
that, and I don't know if I'm opening a can of worms here, but I just looked at the end date and I realized it's June 21st as it stands right now, which is really late, and that's not counting any snow days, and God knows how hot HOD gets.
Right.
Is it possible? I don't know. This would be up to obviously the NTA. Can we, and parents would probably have to be involved, but can we take some February vacation days off and try to shorten it? No, everyone's like, nope.
I'm not sure
It's
about
so
that.
late
Jen,
though.
but
It's so
two
hot.
things that I could say to
You
that.
can have April, not February.
All right, not February. No, not April.
What we would look to consider with the NTA and with feedback from our teachers and our administrative team, as well as feedback from parents, is possibly shifting one of our we could possibly shift a professional development day or one of the scheduled 10 days to a different time in the year to move that Monday ending up to Friday. So maybe put
I don't know.
Year
It's
last. We have to look.
teaching in a hot school that ended last week. It's really not, in my opinion.
Well,
There's just a thought,
also
but the majority says no.
I guess also
We've got a
separately
lot of
that
work
this
done.
year more than any other year, having those weeks off for cleaning to be done with the students, that is really important.
That's true too.
So I think that
Yeah.
this is the year. I agree with you, Jen. I think that's an interesting idea, but I just don't. This isn't a year for it, I guess.
Yeah, I think looking at schedule of PD days would be a better way to resolve that. And I know Tom has his hand up, so we'll jump to Tom in a second.
I thought he was high five.
Don't
but-
get mad
I
at me,
didn't know what
Tom.
was
I'm
going
just
on.
looking at the end of the
is not
year.
ideal. One thing I want to share, though, before we jump to Tom, is with our current plan of students all having an individual device that they bring back and forth to school. If we have a snow day, I don't see any reason we can't transition that to a remote learning day. Because all the schools will be at home, every child has access, every child has their device, and we have a platform ready to go. So we may be
Great
able to prevent additional days at the end of the school year by having that plan in place. We also do have a heat day plan for each child day. So we have, and you'll see it in the published final report, a guideline for when the heat and humidity levels rise to such a point that we would need to transition to remote learning for H olive day only, because those rooms are not air conditioned. And if it's too hot, we can't safely have staff and students wearing masks. So we do have a heat plan for that. But Tom, you wanted to jump in on the calendar.
I just wanted to remind Jen that the calendar that we currently have has the end date of the 17th, which is a Thursday. The 21st that you're talking about is about the calendar vote that you are not going to have today.
Right. Good. Thanks, Tom, for clarifying
Thank you,
that.
Tom.
Yeah, that was our effort to try to bring forward more days for the
I
beginning.
gotcha. Okay. Thank you.
Okay. All right. There is a question in the chat. Do you want me to jump to that, Tom, or Thomas, or do you want to come back to it? There's one question. Monitoring students.
Well, I guess I think there's two that we needed to get to. There was a discussion, I guess, and maybe touch upon this, but what would be the plan regarding staff specifically? Teachers' bathrooms, their lunchrooms, any of the teacher-only areas, what would be done for their safety? And then the second question was, how will basically everything be monitored if most children are asymptomatic? Will there be any daily testing of students and or staff?
Okay, so I'll address them both in turn. We are looking at finding a safe separate space where teachers can have lunch, so that they would be able to socially distance and have lunch in a separate isolated space. And part of the reason we want to add additional custodians to the daytime staff is so that we can clean bathrooms and lunchrooms and all of those shared spaces more frequently throughout the day. We also have hand sanitizer and all the required equipment available for teachers in all rooms of the building. So we have been looking at that and planning for that. Right. high school. Sorry, I don't know if you can hear me over that. As far as most children are asymptomatic, what we will not be, the medical advice at this point is to not take daily temperatures, that they are not helpful in identifying students that may potentially have COVID. We are going to send home very clear guidelines to parents as to when home. If they have a fever, if they have a headache, stomach, if there are any of the symptoms that are affiliated with COVID, we would be asking parents to keep their student home, or if they've been exposed to testing positive for COVID. Additionally, the research is indicating is that children under the age of 10 are less likely to spread COVID if they do get it. So we are developing our practices for that based on the most recent medical guidance. The risk to staff is greater from adult to adult contact, so we are going to have daily screening for staff, and we are working to look at what we can put in place in terms of testing for staff that need it. All right. All right, I think that's the chat question. So should we jump on? Somebody does not have their mic on, mic muted. So if you are on the call and your mic is not muted, if you could do that, if we're getting some background noise, I don't know if everybody else is hearing that as well. All right, the next item that we had on the agenda for tonight, as long as there's no other questions from committee members on the status of the reopening plans today. Okay. We have a recommendation for the committee to consider to approve a 1% cost of living increase for all of our non-union employees for fiscal 2021. So that includes our paraprofessional instructional staff, secretarial and clerical staff, our maintenance staff, our staff and cafeteria staff, and then people with individual contracts. So we are recommending that we move forward with a 1%. We had originally budgeted a 2% cost of living increase for non-union staff. For budget reasons and because many of the additional costs of COVID, we aren't able to support the 2%. So we are recommending the 1%. Most of our non-union staff salary scales only have 3 to 5 steps, and almost all of our staff are at the top steps, so they are not going to be accessing a step increase. At the town level, most of these positions, the salary scales have many more steps than ours do. So we have a challenge too, that we have some shared staff with the town who will be making more for the same job at the town side than they will be making for the school side. We also have significant concerns if we don't keep those professional positions competitive with the region, that we will have a really difficult time filling many of them in the fall. There's a shortage. There's many people who are choosing not to, who may be taking leave of absence or choosing not to return. And our ability to recruit, fill our paraprofessional, our secretarial, our staff positions is really really critical for us. So we are recommending at this point that we report is not 2% original cost of living, but a 1% cost of living for all of those staff members.
Okay. Do we have a motion on the proposed 1% increase for the non-union staff?
I propose that we accept the 1% increase as stated. I move that we.
Okay. Do we have a second?
Seconded.
Okay. Any further discussion on that? So, Dr. Allard, this is a very a limited overall financial impact in terms of the overall school budget. Is that correct?
Yeah, it's about 30,000, including all people that would be included in that category. So it's a very low number.
Okay. Fair enough. Any further discussion? Okay. All in favor? Aye.
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 Right. And then the last item we have.
Yeah, we
I
lost.
think
Sorry.
Ken dropped off.
Oh,
Okay.
the one abstain.
All right. So 4-0 officially.
The last item we have for tonight to consider is offering an early retirement incentive plan. We had offered one back in the spring, and we didn't have anybody take it, although with the significant changes that have happened over the summer to reopening requirements, we do have some people that would be possibly interested in the early retirement. At this point, I am recommending that the school committee consider that. The packet and what is included in the early retirement is outlined in the packet that you have. basically, it is a self-funding program because when teachers retire at the top of the salary scale, the difference that we are using to fund the incentive is offset by the lower cost of hiring a new teacher at a lower point in the salary scale. So this will not result in a cost to the district. It actually could result in some significant cost saving that could be allocated to other positions. It will also help for teachers that may have an existing medical condition or feel that it's unsafe for them to return because they're in a high risk category, to have a way to consider retiring instead of returning under the conditions that we'll be reopening under. So I would recommend, because it is a cost neutral plan that could actually lead to some savings to the district and serve our long-term veteran teachers well, that we move forward offering this early retirement incentive.
Okay. Do we have a motion to move forward with offering of an early retirement program?
So moved.
Do we have a second?
Second.
Any further discussion? All right, seeing none, all those in favor? Aye.
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 All right.
I think we got everybody.
That was all that we had for tonight. This was actually an extra meeting. We don't usually meet in July, but I wanted to make sure that everybody was informed about where we are with our plan for reopening. And we wanted to resolve the retirement and the COLA issues. So thank you for being willing to join an extra meeting. And I think we have some minutes to approve and then we need to talk about the next meeting date. So I'll turn it back to Thomas.
All right, so we need a motion to approve the minutes from our June 25th meeting. Do we have a motion for that?
I move to approve the minutes.
I second that
Do we have
motion.
a second?
Second.
A lot of seconding. All right. Assuming no further discussion on that, all in favor? Aye.
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 Okay. And then, all right. So then, as we discussed, we're scheduled for the 18th of August. That obviously does not work any longer with the items that Ingrid laid out for us. So sometime next week would make the most sense. Don't discount the possibility of we meet a second time in August, but for the purposes of immediate planning, let's go with sometime next week. Is there a date or a day, that works better? I know I've got nothing but time right now, so Thursday's fine for me. It's up to you, everyone else.
If possible, I'd like to push it to later in the week because we do have to meet and work with the association and the admin team on a calendar proposal. And we have we just received guidelines for special subjects for art, music, and physical education. And we have some finalization of the plans that I get done with the team. So later in the week is better so that I can have the most comprehensive and final plans available for you to consider. So I would prefer Thursday if possible for everybody.
All right. Is there anyone who can't do Thursday, I guess is the question.
It's Shannon. I have, I registered for the charting the course and 2 of my courses are that night,
Yeah,
but
yeah.
I can try and see. I think the other 2 were I think the same courses were offered tonight. So I did it the 6th. Did you too, Sarah?
Yeah, me too.
Okay. So I don't know if we can, I think that's the last day too, Sarah, right? Thursday?
Yeah, it is. And it runs like 5:30 to 9 or something like that.
We could do Wednesday. I could do Wednesday if possible. I might have a few last details that aren't resolved, but we'll have certainly enough to determine which plan is best for the calendar. So
Yeah, that works.
I can't remember which days I signed up for that charting the course. I think I had to move all of mine to that week. I don't think I have any on Wednesday though.
I don't. All of mine are this week, and then I just have the 6th, so I can do Wednesday.
All right. So at the very least, we'll have a quorum for Wednesday. It sounds like we have at least 4 and then possibly Sarah being the 5th. So let's just move forward with Wednesday if that's okay.
That's good.
And the only 2 items I would assume that we will have on the agenda is to vote to approve the final calendar on the plan.
Okay, got it.
Okay.
So what was that Wednesday? What date is that? August what?
5th.
5th, I think.
Okay, thank you.
Yep, the 5th. All right. That's all we had.
All right. All right. So we are, all right. So we need a motion to adjourn for the evening.
I move to adjourn.
Okay. Do we have a second?
Second.
Okay. All in favor?
Aye.
Aye.
Bye.
Thank you,
Thank
everyone.
you.
We will see most of you
Everybody
next
have a
week.
good night.
Thank you so much.
Good night.
Good night.
Bye.